Hi everyone. Hello college parents, grandparents, aunties, and uncles. My name is Dr. Nicole Rochester. I am a board certified pediatrician, a private health advocate, and the CEO of Your GPS Doc. The mission of my company is to help individuals navigate the complicated healthcare system. I also happen to be the mother of a rising college sophomore. We will be dropping her off back to school in about 2 weeks. And I know that many of you have either already dropped your children off to begin college, or you will be doing so in the next couple of weeks. So I wanted to let you know about a wonderful resource. I wrote a book, Healthcare Navigation 101, a guide for college-bound students and parents. And I initially wrote the book as I was preparing my own daughter last year to go away to college. And as I started thinking about all of the things that she needed to know in order to properly and effectively manage her health and her health care on her own, I thought everybody needs this information, not just my daughter. So I wrote a book. So this information is incredibly important. And I know that you all are busy shopping, getting things for the dorm or for the apartment, and this may be the furthest thing from your mind. But please stop and consider the fact that for all of their lives, we parents have basically been their voice in healthcare settings. When we take them to doctor's appointments, we are the ones sharing the medical information. We are the ones providing the history. And now your child is going to be all by themselves. And the question is not if they're going to get sick, but when. And I hate to say that, but it's absolutely true. Hopefully it will just be a minor illness, maybe a little cold or a flu bug or a minor injury. But the reality is that some of our kids will have serious injuries or illnesses. And in either situation, they need to know how to navigate this complicated and crazy healthcare system. So I'm going to be bringing some tips in these videos. And so today I wanted to focus on one tip related to their ability to communicate their health history. So tip number one is to make sure that your child knows his or her health history. That includes not just their own personal health history, but it also includes the family history. So they need to know if there's a history of heart disease in the family. They need to know if there's a history of mental illness in the family, because these things may impact them while they are in college. They need to know if they had a surgery when they were 2 or 3 years old. They need to know if they're allergic to a particular medication, because that information is critically important when they are at that student health center, when they are at that urgent care center, or God forbid, if they have to actually go to the local emergency room. So I am happy to say that one of the resources available to those who purchase the book is something called a health navigation summary. And that is a document that you can print out, sit down with your child and complete. And it walks you through all of their health information so that the two of you can discuss those illnesses that they may have had when they were younger that have resolved, any surgeries that they've had, their medical conditions that they may have now, the names and the doses of the medications that they take, and their family history, as well as there's information about their doctors, their names, their phone numbers, any specialists that they may see, so that if they find themselves having to see a doctor in their new college town, that person can communicate and reach out to the doctors who know them best if necessary. So I encourage you to go to Amazon and grab a copy of Healthcare Navigation 101, a guide for college-bound students and parents. It is available in both ebook and paperback format, and you do not need a Kindle device for the ebook. I guarantee you, you will not regret it. And I will see you for my next video with another important tip related to college health. Take care.